In this short video, I will like to explain what tests normally your doctor does to look for congenital anomalies or birth defects in the baby. The first test that we start for, and which is mandatory, is called a double marker and an NT scan. So it is an extensive, vast ultrasound and a blood test which tries to detect chances of chromosomal abnormality and your risks for getting neural tube defect, also for risks for getting blood pressure related complications of pregnancy. The next mandatory test is called a TIFA scan, which is a targeted fetal anomaly scan. This is done in the 18th to 20th week of pregnancy. This is a scan which should be done properly at the right place. It is a scan which takes time. It is a detailed exploration of the fetal body as far as possible to detect for abnormalities. Another test which you should know about is called NIPT, which is non-invasive prenatal test. This is a blood test which is done from the mother's blood to look for the baby's DNA and try to detect certain chromosomal abnormalities. Now this is a test which is expensive, therefore we reserve it for women who are high risk for birth defects, certain kind of birth defects. So you have to ask your doctor about NIPT, and if one can afford it, then it can certainly be done as a routine around 12 to 13 weeks of pregnancy. Other than these, we have some targeted tests like CVS, which is chorionic villus biopsy. Another is amniocentesis. These are very high-end invasive tests which are only recommended in certain situations, especially if one has had a prior history of any birth defect. When we have a target as to what birth defect we are looking for, in those situations we should be doing these tests. To summarize, there are many birth defects possible in a newborn. Only a few can be detected by certain prenatal tests. The mandatory tests should be blood markers like double tests, double markers, quadruple marker tests, NT scan, a TIFA scan, and also a fetal echocardiography where it is necessary. Thank you very much.